Hi guys, welcome back to another video of your channel. Today we will be dealing about cough and its differential diagnostic approaches. So if you haven't subscribed our channel yet, feel free to subscribe and hit the bell icon for more updates. So coughing. So in our day-to-day veterinary practice, the most common clinical sign associated with any of the pulmonary affection or cardiac affection or any case of brachial affection would be cough. So there are many reasons why the animal cough. Sometimes it might be due to a systemic respiratory infection, or it can be due to chronic cardiac or pulmonary issues, or it can be due to the abnormalities of the musculature of the trachea or the pharynx or the larynx. So coming to a proper diagnosis based on the main clinical sign, that is cough, is very difficult. Why? Because we need to have an extensive knowledge of the canine upper respiratory tract anatomy and the normal cardiac and pulmonic physiology. So based upon that, with the help of physical examination and some diagnostic aids, we can move into a proper diagnosis. So whenever we are getting a clinical presented case with the clinical sign cough, we should be thinking about the main problems associated with these structures, that is heart, lungs, trachea, pharynx and larynx. So the coughing can be due to like pulling on their lip. So whenever we are going for walking in the evening with the dogs, they might go and mingle with the other dogs, so we might pull the lid. So this can lead to acute tracheal injury or some upper respiratory tract issues. And the other is very common, that is harsh cough, harsh and dry cough. There is kennel cough, pneumonia, dog flu, canine parainfluenza viruses, heart disease, heartworms, which is very common, that is diarrhea, and it can also be due to acute allergies, foreign bodies that struck in throat, tracheal collapse, which is very common in case of this brachycephalic breeds, laryngeal paralysis, and the most common, that is brachycephalic obstructive airway syndrome. So whenever we are getting clinical signs of cough, first we have to go for a chest radiograph. So to obtain a chest radiograph, we can go for diagnostic imaging. So whenever we are going for any diagnostic imaging, that is radiography, we should take at least left lateral, right lateral, and according to the severity or the intensity of the cough, we can either choose DV view or VD view. Always remember, in case of ventrodorsal positioning, there is chance of supine hypotension syndrome. So there will be this vena cava compression due to the extensive mass, and that can lead to acute circulatory deficiency and it can lead to shock. So whenever in case of chest radiography reading there is cardiomegaly, we should mainly go for increased left or increased right. So if at all there is increased left-sided, that is left-sided enlargement, mainly if at all there is pulmonary edema, it can be due to congestive heart failure. And if at all there is no pulmonary edema, that can be mostly due to left atrial enlargement and concurrent compression of the mainstem bronchi due to the enlargement of the atrium. And in case of right-sided enlargement, we can see that is heartworm and pulmonary hypertension and congestive heart diseases. If at all there is cardiomegaly, we can go for these things. We can see cardiomegaly by vertebral heart scores. There are standard reference ranges for vertebral heart score for detecting cardiomegaly in each breeds. So whenever there is normal heart size in the interpretation of the chest radiograph, if at all the lungs is normal and there is normal heart size, the lungs is normal, we can see there is tracheal collapse, upper airway problems, allergic evidence, foreign body, tracheitis, tracheal irritation. There might be some lymphadenopathy, that is mediastinal lymphadenopathies can cause these problems. Pulmonary emboli, hypoplastic trachea, which is very common in case of pugs, and bronchiectasis. Whereas, if at all we are getting some patterns in the lungs, that is abnormal lungs, the main differentials that we should have in our mind will be asthma, bronchitis, allergic evidences, pulmonary emboli, coagulopathy, pneumonia, heartworm, foreign body neoplasia, parasitic, paraneoplastic syndrome, bronchiectasis, trauma, pulmonary fibrosis, diffuse parenchymal disease. So, in case of trauma, sometimes the lungs can be abnormal, and in case of normal lungs, also we will see what bronchiectasis. So, it's very difficult to make a proper clear cut differentiation of bronchiectasis and like air emboli or such things in case of a lateral radiograph. So keep this image in your mind, and whenever we are going for lateral radiography chest radiograph analysis, we should always have an image in this mind. Thank you.